time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing it. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Good afternoon and happy Sunday to you. The first day of October. Welcome and welcome to Kidney Hub East Africa. I am half your host, Steve Belcher, also known as Steve the Kidney Nurse. Let's bring on our co-host all the way live from Kusuma, Kenya. Is our brother Moses Kennedy. Let's give him the co-host welcome. Brother Moses, welcome. How are you today?
I'm good, Brother Steve. So
That's
good.
I see you got a new microphone there.
Don't you see it? There are some few changes. Is it
Yes,
clear?
yes.
Excellent.
Excellent.
All right.
Excellent. So how's dialysis been this week?
It's been terrible anyway. I had several challenges. But then I thank God. I've just gone through that. And
You said you had several challenges. Now, we know here in the United States, kidney warriors go to dialysis 3 times a week. And unfortunately, in Kenya, the standard treatment option is twice a week, 4 hours.
Very true. Very true. Twice a week in Kenya. And if at all you need the 3rd dose, then in other words, you have to dig deep into your pocket. Mm-hmm. So you realize most warriors are not unable to afford this, and they end up, the consequences of not having adequate dialysis comes along with that challenge.
Mm-hmm. 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 Did you have any challenges at your dialysis center?
Oh yes, I've been tired. I've been tired since my last dialysis. I had some strength today, and I also had uh, hypotension, and I was reading my figures were going at 86 over 57, 59. So I didn't know what is wrong because I could not go for further investigation, further
Oh, that's
consultation.
hypotension. That's low blood pressure.
Hypotension. Yes, low blood pressure. Exactly. That is what I mean. Yeah. And then I had to get rest most of my time, which is abnormal to me because it is really slowing down. You know, Steve, what happens? Uh, uh, I will not let this condition to consume me. I want, if my time comes, I want not it should not come when I'm on bed, but always on the go. So that is my mantra. That is why always positive.
Got you. Got you.
Yeah, yeah.
Well, today we're going to talk about a topic that impacts many, many kidney warriors, and I'm sure it impacts warriors over in East Africa, and that is sepsis. And basically, when we talk about sepsis, this is a potentially life-threatening condition that occurs when the body's response to an infection causes widespread inflammation. And this comes in the form people having high temperatures and they don't know what's going on, fever. But when it gets down to it, sepsis can lead to organ failure, and if not treated properly, it can be fatal. So, what we aim to do with this show today is to provide a comprehensive overview of sepsis. We're talking about the causes, the symptoms, the risk factors, how you diagnose to have sepsis, treatment, because that's very important, and prevention. So, Brother Moses, I know you have a dialysis catheter. And have you ever experienced an infection or sepsis as a result of your catheter?
Oh yes, severally. I mean, this year alone, I've had 3 infections, uh, and normally infections are not a joke, especially for a dialysis patient, because it means hospitalization and maybe it comes as an emergency. It is an emergency, and also it comes with a financial burden on it. So yes, I've had infection thrice this year, and sometimes you cannot avoid these infections. However, as much as you try to do your best, it is not easy sometimes to avoid this infection. Yes, I've had thrice.
So basically, what you're saying, if one in Kenya that's on dialysis get a bloodstream infection, if they don't have the financial means to pay for antibiotics, then they have to suffer. the consequences.
The consequences. Actually, nobody cares. You are just referred, given a letter, and that is all. So up to that point where you are given a referral letter, the whole idea ends there. Where you go, no one cares. And that is why you see most warriors in Kenya and even other areas in Africa, most part of Africa, life expectancy has been reduced.
All right, let's get into this because this is serious. We got to get to the prevention part and treatment. So, our brothers and sisters in East Africa, if by chance they get this, way that they can get treated, as soon as possible and to prevent anything from happening. So let's start with number one, the cause of sepsis. Now, sepsis is most commonly caused by bacterial infections, but it can also result from viral, fungal, or parasitic infections. Now, common source of infection that can lead to sepsis include pneumonia, okay, urinary tract infections, abdominal infections, and skin infections. Also, if you have a dialysis access, if you're on dialysis like a hemodialysis catheter, AV fistula, AV graft, you can get an infection in your access that can lead to sepsis. So there are many causes, but primarily it's caused by bacterial infection. So if you got a catheter, you got a dialysis access in your arm, it's definitely crucial that if you got an access in your arm, when you go to dialysis, wash your arm at the sink. If they provide a sink for patients to wash their access, make sure you wash your arm with warm soap and warm water. Even when you're at home, twice a day, wash your access in the morning and at night. Because when you get to dialysis and they prepping your arm, they may just do a quick swipe and not really clean the germs or the dirt off of your arm or access. And see, when you have germs on your access, when you stick in that needle, puncturing the skin, now you're into the bloodstream. And any germs or bacteria that you may have on your skin, if that's not wiped away or cleaned away, guess what? That's going inside you where they do the puncture. So my suggestion, if you have a dialysis access, meaning a graft or fistula, on that access arm, try not to put lotion or any type of cream on your access arm. Okay, because when you puncture the skin, it's going into your access, and you never know if you haven't cleaned your skin or your arm in that area and you have dirt, because lotion and stuff attracts dirt. You never know. So when you got a catheter, it's very, very important that you make sure that the dialysis caregiver, when they're cleaning your access port, the catheter, to make sure that they're changing their gloves, they're washing their hands, they're wearing the mask over the nose, because a lot of people had was, staff for, I ain't gonna say MSRA, but staff in their nasal flares. So when you breathing down, they may be breathing down over the access site, the catheter. So that's why they have us wear the mask. But you want to make sure when they take their old dressing off, change your gloves. And then have them clean around. And I showed yesterday this right here. It's called Accept. A lot of units use this to clean around the catheter site and the access site. Now, this is a broad spectrum antimicrobial exit site skin and wound cleanser. Okay. Now, I don't know if they have this in Kenya. Okay. But if you're here in the United States and you're watching this, make sure they wet the 4x4 and they clean around your access site in a circular rotation. But if they ain't changing their gloves, you're at serious risk of them passing an infection on to you. And remember, these catheters, it goes to your heart. This tip is in the back. So a lot of times, if you get a line infection, they're going to pull this out until they clear up the infection. Then they're going to put another one on the other side of you. So that's why it's critical when you see the caregivers not changing their gloves, working on you, make sure you tell them to change their gloves, because you don't want to get a bloodstream infection. So, Brother Moses, anything you would like to say before we move on to the symptoms of sepsis?
I just wanted to echo on access point, because this is where the laxity comes in with the health caregivers. Why? They know the right thing, what should be done, but because they don't care, it is up to you. They are there to work, earn salary, then make sure the end days and go home. So as a patient, this is where you must take a proactive action and ensure that this is not a laughing matter. And this is where, even if there is some fond of friendship, you and the caregiver, then you must now be serious again about it. Why? You have to change your gloves and then ensure that the site and even the access or access are well cleaned. And just like Steve, you've said, because COVID is normal nowadays, almost all the units, they don't put on those masks while actually attending to dialysis patient. So yes, this is why Kidney Hub East Africa is coming in, so that ours is to let you know, and on your part, you play your action.
Okay, well said, Brother Moses. So let's talk about symptoms of sepsis. Now, these symptoms mimic other conditions. Okay, so if you got a catheter, you got a dialysis access, if you diabetic and you got a wound on your foot or somewhere, um, and you experience some of these symptoms, you may want to contribute and say, hey, I may got an infection. So here are the signs and symptoms of sepsis can vary from person to person, okay? But they often include fever or hypothermia. Hypothermia is low body temperature, rapid heart rate, rapid breathing, confusion or disorientation, extreme fatigue or weakness, dizziness or lightheadedness, decreased urine output, skin rash or discoloration. Brother Moses, did you experience any of these symptoms when you had an infection?
Well, mine initially, I had urinary tract infection, and it reoccurred severally. It was treated, off again, treated, and then that is when I got hospitalized the first time. And I also experienced confusion and loss of memory, because later on I was being told by my caregivers that I was speaking things that were out of my mind. So yes, I did experience that, and memory loss included.
Okay, wow, wow. So, like I said, these symptoms are different and vary from person to person. So, now let's look at some risk factors for sepsis. Um, Now, certain individuals are more susceptible to developing sepsis than others. Common risk factors include age extremes, meaning very young or elderly, weakened immune systems due to chronic illness or immunosuppressive medication. You got people who are on the transplant list that need a kidney, or people maybe with cancer. So if you have a weakened immune system, you can be at risk of getting a bacterial infection. Chronic diseases such as diabetes, kidney disease, or cancer. Recent surgery or invasive medical procedure. If they're not doing what they're supposed to do, you go get invasive procedure done, and they not washing their hands or doing whatever. Like kidney warrior may go to the access center and get some work done on the access, or get a catheter worked on. If they not being mindful of what they're doing, they could pass on the germ to you. If you have a presence of indwelling medical devices, like if you on a ventilator or you have a catheter, a Foley catheter in. Substance abuse, people shooting up, and then pregnancy or recent childbirth. These are all some risk factors. There may be more out there. Your thoughts, Brother Moses?
Well, you've just exhausted risk factors, but then these risk factors sometimes asymptomatic, because you can. I mean, these risk factors are sometimes confused to other illnesses, For example, if you talk of 65 years and above, it's quite common with hypertension, right? And it is also common to CKD. So yes, these risk factors sometimes, Brother Steve, we can't avoid them. We can't avoid them. Basically, sometimes we cannot avoid them.
Absolutely.
Yeah.
I'd like to take a pause and thank Miss Elizabeth Oldham for watching the show and commenting. Thank you so much, Mrs. Oldham. We appreciate your support as always. So, Brother Moses, let's look at how sepsis is diagnosed. Now, as I mentioned, sepsis can be challenging to diagnose. When I say as I mentioned, because as its symptoms can mimic other conditions, so you could possibly miss it. However, doctors may use various diagnostic tools, including blood tests, imaging studies, and cultures from potential infection sites to confirm sepsis. So a lot of times, if you're on dialysis and you're at treatment, and let's say one has a catheter, and they may say they have an infection, they start developing chills, and they start having rigors and shaking. What we would do is we'll take the temperature, see what it is, and say if it's like 100, 101, we're going to give 2 Tylenols. We're going to call a doctor, let them know, and then we're going to look at the catheter to see if it's any drainage coming from it. And if it's no drainage, then we're going to draw blood cultures. We're going to draw 2 sets, aerobic and anaerobic, meaning with oxygen and without oxygen. We're going to put the blood inside the bottles, the medium, and that's where if there's any germ, it's going to grow in these mediums. Of course, we send it out to the lab, and then the doctor say, okay, let's give 1 gram of vancomycin. Because most of the time, whatever germ it is, could be staph. And vancomycin is kind of like a broad spectrum. So they want to cover it until they get the results back. The CNS, culture and sensitivity test, to see what antibiotic, the resistance, to see what germ that comes up is sensitive to the antibiotics or resistant. So this is how they pretty much do it in the dialysis unit. And for anyone else, they're going to possibly draw your blood. Now, if you got a wound infection or open wound and it's draining pus, whatever, we're going to use a wound culture and like a stick piece that got a cotton tip on the end, and we're going to swab if anything is draining and then put it in a medium slender tube and send it off to the lab. Your thoughts, Brother Moses?
Oh yes. For the three infection I've had, I've used vancomycin, and I was just the time I was given 1 dose, and it just cleared off without finishing the other. So because because I was unable to get the 2 doses because I was told 3 doses. So uh, uh, I just kept on going with 1 dose, and it disappeared, and it never came again. But then, as I've told you earlier, uh, infection are very common, especially in Kenyan setup, because of some adjustments that need to be done. And what we just need is to be your own advocate, Brother Steve. That is all I will say about infections.
Okay. So as I was just mentioning before Brother Moses was spoke, this is the culture swab that we use if you have a wound like a catheter and you have some drainage coming from it. This comes in the packet, or take it out. Use this part right here, this tip, to culture, and
You
then
get it
I'm sorry.
at the point. You get it at the catheter point.
Yes, at the exit site.
Okay.
Or if you have a access in your arm, wherever it's draining from, we get the sample of the drainage, and then we put it inside here. And it's a medium in here, some gel, put it in. Then we write the patient's information on here, and then we send it off to the lab. And then about 3 days later, they'll send us the result back. If it's positive, negative, it'll say no growth. No growth. But if it's positive, it'll tell you it will identify the germ and tell you what it's resistant or sensitive to. And that way, the physicians, they know what antibiotic to prescribe for that particular germ. So let's talk about treatment, as early intervention is crucial in the treatment of sepsis. Treatment typically involves administering antibiotics to target the infection, intravenous fluids to maintain blood pressure and hydration, oxygen therapy to ensure adequate oxygen supply, supportive care, including close monitoring of vital signs and organ function. And in severe cases, you may have to be admitted to the ICU. That may be necessary depending on the extent of sepsis. We've seen people have sepsis that had to get extremities cut off. Any comments, Brother Moses, on the treatment and early intervention of this nasty condition?
Well, on treatment, it really needs a high suspicion index from wherever you go and get an opinion, or you go seek answers. So, very true that there are different types of treatment option, and what normally sometimes fails most most warriors is because inaccessibility of diagnostic uh, uh, systems that are sometimes not in place. Because if you are requested an MRI and it is not common, it is not available within your area where you live or where you go for treatment, then you see that one also hinders investigation and treatment towards sepsis. So yes, there are so many treatment options that comes with several challenges, that is inaccessibility.
Okay. Absolutely right about that. Let's take a quick pause and pretty much do a quick PSA, Brother Moses, because again, kidney disease is very rapid, affecting approximately 2 million people worldwide. So let's take a short pause for PSA.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.
Yeah, Brother Moses, here diabetes and hypertension are the 2 leading causes of kidney disease. So about 700,000 people each year are diagnosed. So this thing is running rapid. And that's why, I'm sorry, what was you saying?
Really running rapidly, because in Kenya, it's about 5 million Kenyans suffering from CKD.
Yeah, see, that's too much. And if there's no, if there's no information hub to help these millions of people that are coming down with this disease, then what? So hopefully this show can help some of those people that are impacted
absolutely
by kidney failure and kidney disease. So let's talk about the last overview of sepsis, and that is prevention. Preventing infection is the best way to reduce the risk of developing sepsis. Now, we're going to talk about some preventive measures. And, some people may have their own preventive measures, but the most ones that are using that have been what's the word I want to use, that has been successful, are practicing good hand hygiene. That's, as I was mentioning, washing your hands. If you got caregivers that are not washing their hands when they changing your catheter, you should be asking them to do so, because practicing good hand washing is one of the best ways in reducing infection. Vaccination, like pneumonia or hepatitis B, taking proper care of wounds and properly treating infection. Again, if you have diabetes and if you cut your foot or your hand, or if you got any type of wound, that you're making sure you're taking proper care of it. Following your healthcare provider's advice or instructions for medical device care. Like, again, if you got a catheter, you got a Foley, you got a colostomy bag, you got any type of medical device, CAPD catheter, PICC line for chemotherapy, any type of medical device that may be exiting your body, you need to take proper care of it, changing the dressing, cleaning around the exit site. And when you do clean around the exit site, making sure you washing your hands with soap and warm waters, using clean gloves. Also, maintaining a healthy lifestyle to support a robust immune system. So that means trying to eat as healthy as possible, taking care of yourself, getting proper sleep, possibly some physical activity, maybe some probiotics for gut, clearing out your gut. Any thoughts, Brother Moses, on prevention of sepsis?
Oh, well, I know the list is endless, but then even frequent trips to hospital and healthcare centers should be reduced. You should walk in when necessary, and even getting hospitalized also must be reduced. So yes, that is also one way that we can try prevent sepsis.
Mm-hmm. Absolutely. It's nothing to play around with. Again, sepsis is a serious medical condition that requires prompt recognition and treatment. So knowing the cause, symptoms, risk factors, diagnosis, treatment, and prevention strategies can help individuals and doctors better understand sepsis and take appropriate action when necessary. Now, if you're watching this and you have some type of medical device, you got chronic illness, you got a weak, or you got some type of condition where your immune system is suppressed, if you suspect sepsis, seek medical attention immediately, as early intervention can significantly improve your outcome. It can. You could be watching this right now and have a dialysis catheter. and may be experiencing some type of sign or symptom that can possibly be infection or sepsis related, and you not even know. So if you think you are, please go to the nearest, emergency room to seek treatment. Brother Moses, you have anything to say?
Oh, yes.
Okay.
Let me just add on. It is very important also to inculcate better the medical seeking habits. Say if you have to go for a referral today, don't miss, don't postpone it. So that one also comes with preventing.
Right. And let me just say this. Even though the name, the topic for this show is sepsis and kidney disease, you don't have to have kidney disease to get sepsis. Okay? And this is the thing. This is the link between sepsis and kidney disease failure. Sepsis can directly affect the kidneys. Sepsis can cause inflammation and damage to the blood vessels in the kidneys, impairing their ability to filter waste and toxins from the body. Remember, sepsis can lead to organ failure, including kidney failure, if not recognized and treated properly. They got something called sepsis-induced acute kidney injury. Now, AKI is a common complication of sepsis. Okay? And what that does is shuts the kidneys down temporarily. That's why they call it AKI, acute kidney injury, where the kidneys suddenly lose their ability to function properly. And when this happens, this can lead to a buildup of waste products and fluid in the body, requiring immediate medical attention or dialysis. Okay? Now, in most part, if you get AKI, acute kidney injury from sepsis, your kidney function normally comes back after they get rest, get the antibiotics, you got the dialysis taking the place while the kidneys are temporarily shut down. But then you got sepsis as a risk factor for chronic kidney disease, CKD. If you survive sepsis, can increase the risk of developing chronic kidney disease in the long term. That's why when they had COVID, an infection, a lot of people went on dialysis because of COVID. They didn't have diabetes or hypertension. So definitely pay attention, be aware, okay? Again, signs and symptoms of sepsis include high fever or low body temperature, also known as hypothermia, rapid heart rate and breathing, confusion or disorientation, something that Brother Moses experienced when he had sepsis, extreme fatigue or weakness, decreased urine output, pale or mottled skin, and shortness of breath. So as we come down to a close, it's extremely, extremely important. Again, if you have a catheter or some type of medical device, or you have a chronic illness and you start all of a sudden experiencing some of these symptoms, don't wait or hesitate. Go get checked out as soon as possible. Anything you would like to say, Brother Moses, before we?
Well, I just want to add on the relationship between CKD, CKD and sepsis. Sepsis can increase the risk of getting acute kidney injury, and then kidney disease. CKD can also increase the risk of sepsis. How? When you get an infection through access, then definitely it is CKD that has increased the risk of getting sepsis. So yes, it can happen, and vice versa.
All right. That is true. That is true. So, Brother Moses, this has been a very informative show. We had some comments. Brother Edwin Eddie Isaac said, good job. Keep it up. This is very informative. Ms. Oldham, she said, you guys are providing quality information. She also said, Brother Moses, your complexion looks healthy. And then she spoke, said, hi, I switched over to watch on YouTube. So again, we want to thank Edwin Eddie Isaac for commenting and watching the show on Facebook, and Mrs. Oldham for watching our show on YouTube. Now, look, guys, if you're watching this today, whether it's on YouTube, Facebook, or TikTok, it's very important that you spread the word about this broadcast. Because again, there's no other show like this. Most of the shows that come on Facebook are interviewing kidney warriors who may be looking for a transplant or have gotten a transplant, or talk with medical professionals. Here, we try to go across the spectrum of talking about topics that impact kidney warriors directly. And we know that sepsis is one condition that impacts kidney warriors worldwide. So please spread the word. We're here pretty much every Sunday at 1 p.m. Eastern Standard Time, United States, and 8 p.m. East Africa time. Okay? Every Sunday, pretty much. So, Brother Moses, you have any departing words you would like to say before we conclude our show?
Oh, yes. One thing about this show, as it gives information to kidney warriors, even the public, you are not left behind. Today, we were talking about sepsis. Sepsis you must not have a kidney disease to listen to this program. It is of benefit whether you have kidney disease or not. Otherwise, thank you guys for watching today. I am your co-host, Moses Kennedy, your kidney ambassador.
Thank you, Brother Moses. Well said, well said. And we definitely are sending blessings for you to have a safe and very productive treatment this week. And look forward to seeing you next Sunday, same time, same place, as we discuss another important topic that impacts our brothers and sisters in East Africa. So with that being said, Brother Moses, take care. Everyone else, take care. Thank you for joining Kidney Hub East Africa. We are your hosts. I am Steve Belcher, also known as Steve the Kidney Nurse, and our brother Moses Kennedy, the Kidney Ambassador.
Oh yes, I was just forgetting something.
Sure.
All right. Today marks the beginning of a weather phenomenon known as El Nino. El Nino is characterized by heavy rains across East Africa. So I'm talking to every warriors out there, wherever you are. You need to get prepared for emergency because transport shall be paralyzed. The cost of food will go up. So basically, you need to prepare. Even if you don't have enough to prepare, always prepare for a day ahead. Thank you very much and welcome back.
All right, brother. That was that's good to know. And when is this supposed to take place?
It was expected to begin today up to next year, 2024, January. So it will be horrible. It will be. It is a national disaster. Actually, it has been declared a national disaster here. So we need to get prepared. That is
so
what I'm
maybe
calling
we
all
have
upon.
to. Maybe we had to talk about next week emergency preparedness again. Get kidney warriors prepared and prepare some type of emergency preparedness kit so they won't be caught off guard. So thanks for that, and I'll definitely be in touch with you, Brother Moses, about that as well. So with that being said, we'd like to thank everyone for tuning in. We'll see you next week, same time, same place. Take care. Take care, Brother Moses.
All right. Thank you so much. Take care, brother.
All right.